The World Health Organization says some parts of the world may already be experiencing a second wave of COVID-19 infections. China, India, South Korea and a number of other countries have seen case numbers rise after reopening their economies.
Now, India has overtaken Britain as the world's fourth highest recorded number of coronavirus cases, and the financial capital Mumbai has been hardest hit by the virus. Arun Kumar is the CEO of Apnalaya, an NGO in India that has been trying to stop the spread of the virus in the slums of Mumbai. And Arun joins us now via Skype. Thanks for taking the time to speak with us. Arun, if you could just explain to us, why is it that the virus has spread a lot more in Mumbai than anywhere else in India?
Hi, good morning. I think the reason why it has spread much more in Mumbai is because of the population density. As you know, 22% of Indian population lives in slums. That percentage is 42 in Mumbai. What we are talking about is about 8 million people living on just about 8% of the city's landmass. That's one reason why it has spread so much and so quickly. The second reason is that the basic norms like washing hands frequently, something that we take for granted, is a struggle. More than 60% of the people living in slums have to buy water. They live in informal settlements, and those settlement slums are without some of the most basic facilities. The third reason would be simply lack of testing. Till date, for instance, the Indian governments, state after state, have not made ward-wise or district-wise testing data public. So we do not know what is the total number. We do get aggregated numbers for the entire city, but we don't know, for instance, how many of those testings are happening in slums, areas where they are most needed. So these are the three basic reasons why they have spread much more quickly and in such a huge scale in Mumbai.
You have been focused on one of the poorest and most underdeveloped slums of Mumbai. It's called Shivaji Nagar. And I read that some 600,000 people live in this particular slum. And this slum is right next to Asia's largest dumping ground. The residents in this particular slum actually took matters into their own hands right at the early start of this pandemic. And your organization was there to help them. Could you just take us through what happened right at the start of the pandemic?
As you know, on 27th March, a lockdown was announced nationally in India. It barely gave people 4 hours to prepare. The lockdown was announced at 8 p.m. That's not enough for most of the people who are daily wage earners. What I mean by daily wage earners is that we have a significant number of people who are hands to mouth. If they don't get to go out and work, they will have probably nothing to eat in the evening. So it was a bad start, poorly planned. About 57 to 58% of people that we work with are daily wage earners. And the government probably didn't think about how these people are going to make both ends meet. That was the beginning of it. When we look at the second and third week of lockdown, there were what in India is known as ration card system, public distribution system, basically trying to have access to food and food-related security. It was very, very late to arrive. Till 15th of April, free ration distribution could not take place. Apnalaya as an organization, we knew what we had to do. We knew our people, the community where we work. We realized that we don't have enough time. So within a matter of 2 to 3 days, our workers were on the ground trying to distribute food grains. Because we knew that people were not left with any major savings. They cannot sustain themselves. So providing daily provisions, food, was our second attempt. The third thing that we did was basically talk about conditions in slums to the media. You know, most of the people who live in slums, their everyday struggle remains completely invisible. So we not only needed to provide food material and everyday sustenance, we also needed to talk to the media people and basically bring it out, the real, the harshness, the reality of life on the margin. So these are the things we have been trying to do.
Arun, what do you think other cities can learn from Shivaji Nagar's experience?
There are 2 or 3 things that I would like to share. One is what this pandemic has done is basically highlighted the lack of basic amenities in terms of health, in terms of welfare system. The second thing that this pandemic has done is that it has shown us how a medical crisis can almost overnight turn into a humanitarian crisis. It didn't need to, but it has, simply because basic amenities are not in place. So, for instance, as you rightly said, Shivajinagar has nearly 600,000 population, but there is one major hospital. There are very few health posts. So when the load of virus infection rose, most of the hospitals shut their OPDs, the outpatient departments. So poor people didn't have any place to go. So one data, for instance, suggests that 69% of deaths happened between 2 to 24 hours. What it suggests is that people were admitted to the hospitals very, very late. They should have come earlier.
Right.
That didn't happen simply because there isn't enough hospital beds available. Imagine the richest municipality of the country, Mumbai, has barely 700 hospital beds, ICU beds with ventilators. These are some of the things that got highlighted during this pandemic.
Arun Kumar, we're going to have to leave it there, but thank you so much for sharing your insights and your experience with us. Arun Kumar, CEO of Apnalaya.
Thank you.